This year, the American Cancer Society estimates that more than 600,000 people in the U.S. alone will die from some sort of cancer. In today's HealthCast, we look at how some, though, are beating the odds against even late-stage disease with novel approaches in treatment. In September 2010, Mary Nisbet was handed a death sentence.
Put your things in order. You're not making it to Christmas, and Christmas was, what, 3.5 months away.
She had ignored the signs of endometrial cancer, and by the time it was diagnosed, the cancer had metastasized.
It is my own fault. It is. I'm a victim of delay.
Hi, Mary.
With no hope from conventional cancer treatment, Mary turned to Dr. Mark Rosenberg, a traditionally trained physician who now works with alternative approaches to disease treatment and management.
It's a complex protocol of many non-toxic drugs that affect many different pathways of growth for the cancer.
Rosenberg found that most cancers feed on glucose and process it through a mechanism called glycolysis. The end product of glycolysis is lactic acid, which cancer cells need to get rid of in order to survive.
And my theory was, if we can use different drugs or different modalities to block the ability of the cell to get rid of its own acid, the more it feeds, the more acid it makes that it can't get out, and the faster it'll kill itself.
As we saw when we first interviewed Mary 3 years ago, the process involves a complex regimen of non-toxic oral drugs and nutritional support.
What we are trying to achieve in this country is to turn it into a chronic, manageable disease.
And so far, it's working. When Mary's tumor markers went up last fall, her disease was more indicative of stage 1 than stage 4 cancer.
Just breathe normally.
Following surgery, she continued with Dr. Rosenberg's treatment, and today has no symptoms of cancer.
It is hopeful, and that's what I would love to explain to folks. Keep yourself open to alternatives.
And this treatment approach is not a cure for cancer. The only way to actually cure the disease is to kill the cancer's stem cells. And at this point, there's no drug nor therapy that can do that. But you know they're hard at work trying to figure out a way, Victor.
All right.